Hello, we are Group 19, and we wanted to look at the effectiveness of Stewardship program on antibiotic resistance. So our research question is there a correlation between implementation of the Stewardship program and a decrease in antibiotic resistance? So first, we wanted to go over some background information. Some of the causes of antibiotic resistance are overprescription of antibiotics, patients not finishing the antibiotic course, overuse of antibiotics in livestock, poor infection control in healthcare settings, and poor hygiene and sanitation. We wanted to focus on the overprescription of antibiotics because at least 30% of antibiotics prescribed in the US are unnecessary. To put this into perspective, about 154 million antibiotics are prescribed each year in the US, and about 46.2 million of them are not needed. A possible solution for this is the Stewardship program. And so this program aims to reduce the amount of antibiotic resistance as well as the spread of resistant pathogens. So this program has 7 core elements, and they are hospital leadership commitment, which is dedicating necessary human, financial, and informational resources, accountability, which is appointing a leader responsible for the program management and outcomes, pharmacy expertise, which is to appoint a pharmacist to lead the implementation, action, which is to implement interventions to improve antibiotic use, tracking, which is to monitor antibiotic prescription and resistance, reporting, which is to regularly report information on antibiotic prescriptions and resistance, and finally, education, which is to educate healthcare workers about the adverse effects of antibiotics resistance and prescription.
To explore the correlation between the implementation of the Stewardship program and antibiotic resistance, we wanted to look into the pathogen CRE because it's common in hospital settings and it can be very life-threatening and hard to treat. So in our first figure, you can see from 2014 to 2018, the percent of hospitals implementing the Stewardship program increases. And in blue, you can see that the percentage of people testing positive for CRE decreases. We wanted to explore if this decrease in the number of people testing positive for CRE was due to the implementation of the program or if there's another factor causing this decrease. So in figure 2, we compared the average implementation in each state with the change in their antibiotic resistance from 2014 to 2018. So in this graph, you can see there's really no correlation, meaning that hospitals that have a high implementation rate do not necessarily have a large decrease in antibiotic resistance.
Yeah, since we have concluded that there is no correlation between antibiotic resistance percentage and program implementation percentage, we decided to look at different variables that might have affected the outcome. We observed the hospital density as one of confounding variables. As you can see in the figure 3, we found out that as hospital density increases, the antibiotic resistance percentage also increases, showing positive correlation between the two variables. We also have tried to plot the average antibiotic resistance percentage versus implementation percentage, and we saw a slight positive correlation, meaning states with higher implementation rates actually had higher levels of antibiotic resistance. However, this graph is not representative due to other factors such as population density and number of samples. In order to apply a cause and effect relationship between the two variables, more research needs to be conducted to evaluate the effectiveness of the Stewardship program. Using the current data we have, we cannot conclude that the program is effective at decreasing antibiotic resistance or unnecessary antibiotic use. Thank you so much.